Hi, I'm Lacey Nobles with the City of Lubbock. We'll start our news conference in just a few seconds. Good morning, and thank you for joining us for the City of Lubbock COVID-19 news conference. We have a lot to cover today with our panelists, Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, and Lubbock Mayor Dan Pope. So let's kick things off with Catherine Wells.
Good day, everyone. Today I'm going to update you with the current number of COVID cases here in Lubbock County and also some of the activities the health department's been involved in over the last week. On Tuesday, Governor Abbott announced that COVID is spreading at an unacceptable rate in Texas. This statement definitely holds true here in Lubbock. The health department is now reporting 1,541 cases of COVID-19 as of yesterday evening, June 23rd. Of these, 671 are recovered, but we now have over 825 active cases of COVID in our community. For the third week in a row, there has been an increase in the total number of cases. This last week, 593 cases were reported compared to only 194 cases in the previous week. Yesterday was the highest number of cases ever reported in one day at 140 cases. The department is on track to report over 100 cases this evening. The majority of new cases continue to be in the 18 to 25-year-old range. 50% of the cases from last week were in this age group. However, it's not just this group. The health department has found an increase in the number of cases in office environments. Social distancing, facial coverings, and good sanitation are just as important at work as they are when you go to the grocery store. If you're ill, it's important to stay home. If you're a business owner or manager, it's important that you allow staff to stay home if they're sick without it negatively affecting their employment. Controlling the spread of COVID-19 requires the entire community, and I ask everybody to continue to be vigilant and follow these guidelines. Be smart when you're out. Frequent businesses that are following the Lubbock Safe guidelines. Practice social distancing and wear a face covering when you're at work, at the store, or with large groups outside your family unit. That's my update for today, and I will now pass it over to Dr. Cook.
Thank you, Catherine. Let me just reiterate what Catherine said. You know, our numbers are increasing. Even our hospital numbers are increasing. And that's our biggest concern here in the city is, are we going to overwhelm our hospital system? I know that if you get sick and need to go to the hospital, or one of your loved ones gets sick and needs to go to the hospital, they'll want a place to be so we can take care of them. As a physician, that's my job, is to take care of sick people. So we must be careful about how we can stop this virus from spreading. You know, Houston already has now, there was a story in the news where there's a Houston pediatric hospital is now taking adult patients because Houston hospitals are so full of COVID patients that an adult is now having to be admitted to a pediatric hospital. They are quite capable of doing that, but that's not their specialty, but it's going to have to do. Please know that our hospital systems here are in good shape to take care of us, but we cannot allow the system to be overwhelmed. So in saying that, many of you have also heard about herd, like cattle herd immunity. And herd immunity, some people say, well, I'm just not going to do my social distancing and I'm not going to wear my facial covering because I have to help build up herd immunity. Let me define what herd immunity is. Herd immunity is when enough individuals in a population have been exposed to the disease, have gotten sick from the disease, and then have recovered from the disease, and now they have immunity to the disease. And so, this is how herd immunity is developed, but what's the importance of herd immunity? So then, if we have enough herd immunity and a sick individual comes into that community, then that person cannot pass on the infection to anybody else because all the other people surrounding that sick person has immunity, so they can't spread it, so the disease stops. So that's really the definition of herd immunity. How do we get there, or what's the magic number we need to get to? The community that sick person must come into for herd immunity to occur has to have 70 to 90% of the individuals in that community must be immune to the disease. So that doesn't sound like a big number. We do that with vaccines all the time. But however, we don't have a vaccine for that, for this disease. And if you remember Sweden, they decided to practice something. They said, well, we're not going to social distance. We're not going to wear facial coverings. So they recently published a study earlier this week or last week, that said only 6% of the Swedish population has immunity to this disease. 6%. That's pretty scary because they didn't practice any social distancing. So when this virus comes back around, it may reinfect people. We don't know that yet. We don't know enough about this disease to know how long your immunity is going to last. We are months away from a vaccine. So that's the other easy way to get herd immunity, is you immunize a lot of people in the community, just like we do with measles, mumps, rubella, chickenpox vaccine, even flu vaccine. And then if we do get a vaccine, we don't know how long that vaccine is going to last. Is it going to be like flu and we have to repeat it every year? Or is it going to be like chickenpox and we have to give it once in a lifetime or twice in a lifetime? So those are just things we don't know. So don't count on herd immunity and contribute to herd immunity and be lackadaisical. I'm just going to go get sick. The problem with that mentality is now you're going to take it home to somebody. You may do very well with this disease and recover from it quite easily. But there are individuals that are near you that won't recover so well. In fact, some of them may die. And I know that none of you that are listening want to cause the death of somebody else or somebody that you care for. So how do we do that? So now we must continue to wash your hands. We must continue to social distance, and you must wear your facial covering. Masks save lives. Let me just say it again, just like seatbelts, everybody used to balk about wearing seatbelts, but we know that seatbelts save lives. We know that masks and social distancing saves lives. So please do those things. That's all that I have. Mayor Pope, it's to you. Thank you.
Thank you, Dr. Cook. Thank you, Ms. Wells. So it's good to be with you again this morning. Let's start with some our data slides. Let me share my screen. Okay, sorry, I wasn't at the right spot. So let's some of these will look familiar to you. There's a new slide at the end. Active cases by day. Ms. Wells has spoken to this, that we've got to get that line going the right direction. But I'm a little more concerned about some other data we'll talk about in a moment. You can see the new cases by day. Remember that we tested a lot last week, so some of that is influenced, or the last 10 days, and some of these are influenced by that. I'll share some more information on that in a moment. Hospital data, our hospitals remain strong. We talked to both Covenant and UMC late last week. Things are returning to normal. They're safe. We want to encourage you that if you have medical needs that are emergent, that you need to be in the hospital, make sure you don't put that off. We continue to really focus on the fact that, unlike other parts of the state, Dr. Cook just called an example, we remain in a very good shape. We had 29 people in the hospital yesterday, only 10 of those in ICU. Okay, so this is the sort of our test versus our positivity rate. Let's go to the next. This will show a little better. So this is the last 7 days of tests. So we've reported right at 6,000 tests since we last talked. 593 of those have been positive. So That means that 9.9% of the tests that we reported in the last week have been positive. And if you've been following our data, you know that through the first 85 days of this pandemic, we were about somewhere a little under 3.5% of our overall tests were positive. So there's a good and a bad to that. I think the good is the increased testing. I think a lot of the increased testing is from people that know they've been in places where there's been the active spread of COVID-19. Certainly the bad is we want that rate to go down, and we believe it will over time. But let me show you one more stat that I think, one more slide. This is our case count by age group over the last 2 weeks. 64% of our cases in the last 2 weeks are in this one 10-year demographic, age 20 to 29. Now, there's good news there. They are very, very, very likely to recover. The bad news is that they're also very active in our community. Many of them work in your businesses. Many of them might be your kids or grandkids. They might be your neighbor. We need to make certain that we all take this seriously. Now, in the same time period, only 33 cases of this group, this 700, nearly between 700 and 800 new cases. Only 33 cases, less than 5% of these cases we've identified as community spread. I think it's important to know that we've been able to trace and understand where the spread has been from another known case. It's not, we don't have it growing in the community in a way that we cannot identify. And I think that's a very important part. I want to turn off my screen share. Okay, let me finish with this. We've got to coexist with COVID-19. We have reopened. We will stay open. We know how to slow the spread. We've proven that we can do that. We can't relax. COVID-19 has not taken the summer off. In the last 2 weeks have certainly proven that. I want to reiterate what Dr. Cook and Ms. Wells said, what the governor has said about face coverings and about our social, sort of our personal hygiene practices, our social distancing, our hand washing, our covering our mouths. I mean, those things work. We know they work. Wear your face coverings. We want our lives to return to a fashion that's both safe and sensible. It's because everyone is important that we continue to take the measures that we take. We will continue to test and trace and isolate those that are positive. We'll also continue to tweak our strategies as we learn more. We'll continue to make certain that we explain to you why we're doing things differently. We can slow the spread and have a more a life that we recognize more readily than where we are today. But to do that, it requires common sense. It requires some West Texas spirit. It requires some perseverance. We've got to do things the right way. We cannot let our guard down. Lacey, back to you.
Thank you, Mayor Pope. Now we'll open it up for media questions. Today's media order is Latina Lubbock, KMAC, Fox 34, KLBK, El Editor, Lubbock Avalanche Journal, Texas Tech Public Media, the Daily Toreador, and KCBD. So let's get started with Christy Martinez Garcia with Latino Lubbock.
Good afternoon, Christy Martinez Garcia, Latino Lubbock Magazine. Mayor, we often learn from experience. When we came into COVID-19 in March, we knew nothing about it. And over the last 3 months, we've learned that hand washing, social distancing, and wearing masks, everything y'all just said, does help to restrain it. Now, the governor said it was up to local officials to mandate masks in public. How can people take mask wearing serious when nothing serious is being done? Why won't you put into place mandated mask wearing that will appease the public and businesses?
It's a good question. Thanks for asking that. I didn't think it would take long for that question to come this morning. We spent time in our city council meeting, both publicly and in closed session last night, talking about this very topic. Our council, I think, is on the very same page, all of us, and that we're not going to mandate something that is unenforceable. The governor's made it something that we cannot enforce. And I think it's would be if we mandated mask wearing and people chose not to do that, then all that would happen would be our phone would ring at City Hall or the police department, and things that needed to happen wouldn't get done because we would hear people calling and tattling on their neighbors. We need people to take personal responsibility. It's like wearing your seatbelt. Wear your seatbelt. Cover your face. I think that message is as simple as it can be. Wear your damn mask.
Rapidly worsening coronavirus numbers in Texas, Mayor, reached new milestones yesterday. As you know, the state surpassed 5,000 new cases in a single day, including Lubbock, thus prompting warnings from Governor Greg Abbott, who urged residents to stay home. And, just like the safety belts, it is mandated, by the way. And nationally, Dr. Fauci said that the next couple of weeks are critical to slowing surges of coronavirus. On several press conferences prior and into the reopening of businesses, you said that you would consider scaling back if need be. Are you going to scale back? And if not, how can you reassure the public who are concerned that you are more committed to livelihoods over lives?
Well, I don't know how many times I can talk about it. First and foremost, we are under the governor's order, so any slowdown would come from the governor. Second, I just spent my comments talking about how we can safely and sensibly live our lives, and I think that means taking the ultimate precaution, and we will continue to encourage our citizens to do that. You should look for some different communications from us, from the city, potentially in partnership with other large local institutions, where we continue to message and not only educate, but also message to all of our citizens about the importance of taking coronavirus very seriously. Thanks for your questions, by the way, Christy. Thanks for what you're doing.
Thank you, Christy. Now we have Matthew Stell with KMAC.
Thanks so much, Lacey. My first question is probably for Catherine Wells. Catherine, we know that Lubbock has reported more coronavirus cases in the last 14 days than in the previous 3 months combined. Kind of tell us the contact tracing process. What do those discussions look like? And kind of what is the common theme of people getting the virus, or is it just different for everybody?
The contact tracing is going well. We have increased the number of staff that are working on that contact tracing. The themes that we're seeing is, like we talked about last week, we saw huge surge in cases associated with lots of our local bars. We've had, I think a lot of them are taking this very seriously now, and we hope to see some changes there. We have more people out and about, and at the same time, we have more virus circulating in our community. And we really need everybody, to be mindful of that social distancing, paying attention to who you're with, limiting the number of contacts that you have with individuals, so that if you become symptomatic or become a case, we can continue with that contact investigations or those investigations.
And when you're doing that investigation, the folks that you're talking to, are majority of them wearing masks, majority of them not wearing masks? Are they being in contact with people who are or aren't? Or is that just something, once again, a case-by-case thing?
It's really a case-by-case thing. We are still, because the incubation period of coronavirus is 7 to 14 days, we're still seeing the effects of the outbreaks that we were seeing around those bars. Even though some of them have closed for cleaning and haven't even reopened, we're still seeing cases outside or from those. I think there was a lot of time where people weren't social distancing, and hopefully we'll start seeing more social distancing out in our community.
Okay, thank you.
Okay, now we have Blair Sable with Fox 34.
Hello, good morning. Actually, it's not noon yet. So my first question is for Catherine Wells. So currently we have 800 and something active cases in the community, which means that there's more chance for the virus to spread if those people do not, stay quarantined. How are we ensuring that those people are maintaining their quarantine? Is there any sort of service that the city is providing, providing groceries, food, any sort of thing that is making sure that people don't have to leave their homes during that 2-week period?
Yes, so our contact tracers contact all of those individuals that are under quarantine, whether or not they're a case or close contact with a case. We do have an assessment process that makes sure that individuals have have the food. If they express need for mortgage assistance or rental assistance, we then work with our community development department who helps secure those resources.
Great, thank you. And just a follow-up question to something you mentioned earlier, Catherine. You said that we're seeing an increase in cases in office spaces. Is there any recommendations specifically for companies and businesses here in Lubbock about how to make sure that a virus doesn't spread within an office space?
It's the same recommendations we have out in the community. For instance, in the health department, our guidelines or my requirements with staff is that if you are outside of your office, you are wearing a face covering. If we are meeting in a group, we are all wearing face coverings. That's to ensure, in case one of us becomes positive, that our entire health department doesn't have to be quarantined. And those are the types of things that businesses can implement. Also cleaning of high touch areas, still allowing some telecommuting. There's lots of different ways to look at how best to reduce the spread.
Thank you.
Thank you, Blair. Now we have Terry Furman with KOBK.
Good afternoon, everyone. I've listened, to the questions, and they're all great questions. My thing is this: we were all 20 to 29 years old at some point in our lives. Obviously, they aren't listening. They're not listening to these news conferences. They're not paying attention on social media. There are a lot of older people that are saying it's political. The media will shut up after, elections. Well, I don't think that's the case, but how are we getting the message out to 20 to 29-year-olds who are invincible and don't listen?
Yeah, that's I think that's the $64,000 question, Terry. We're going to continue to try to change our messaging, and particularly the people who are delivering the message. I think by now, particularly for me, and maybe even for Dr. Cookham as well, we're like blah, 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 just that we're the ones they see all the time. So I think it's important that we change the messaging, and it's going to have to be more contemporary social media channels. And that's where we will spend the money. In fact, we'll invest some of our CARES dollars to get the word out. That's part of our ability to do that. And we will be aggressively doing that. In fact, our Lubbock Economic Recovery Task Force meets at 1 o'clock today. The communications subcommittee of that group will be reporting to them today. I believe production may already be underway. If you've paid attention, you already see billboards in the community that have been driven from the communications committee already. We're actively trying to change the message and to reach everyone. And the final thing I would say is this is not political. At least it's not for me. To me, it's about safety and providing for the safety of our citizens. And that's when you're elected to the city council, when you're elected as mayor, that's the city charter calls that out as job one. And that continues to be the sort of the bedrock principle that I'm going to base my decisions on.
Okay, my follow-up question is this. We can't get college age or 20-year-olds to socially distance, wear their masks, stay, healthy, all that. How in the world are we going to send our kids back to school with classrooms that are not big enough to socially distance 6 feet apart, with nobody in the bathrooms monitoring little girls who want to sit and gossip, or boys that want to roughhouse? You've got PE coming. I know none of you are on the school boards, but I'm very concerned about students going back to school.
Well, first and foremost, I'm not going to answer that question because I'm going to stay in my lane. I do think there's a way to safely do it, but I think perspective is important too. Okay. So for 100 days or more now, we've been identifying cases. We're right at 100. In that entire time, we're less than 0.5% of Lubbock residents that have a positive case that we're aware of. So we've got to keep this in perspective. It's important. It's very important. It can be a matter of life and death, but we can safely and sensibly live our lives. And I really believe we can do that. And I know that the governor or Commissioner Morath yesterday released some details about what school looks like, K-12 looks like in the fall. I know that there's more to come on that, but I know that I'm in regular communication with the superintendents of Lubbock ISD, Lubbock Cooper, and Friendship. They're on our recovery task force. I have complete confidence that they, along with their boards and their leadership, can do this the right way.
Okay, thank you.
Okay, now we have Olga Aguero with El Editor.
Hello, everybody. Happy hump day. Okay, I've heard all the questions and concerns that all the media have expressed, and I think they're very great and very important. But if it's not political, why can't we just admit that we opened too soon? And for the actions that are happening right now, we should let people know if it does not get better, we will go back. And it won't fall on you, Mayor, but it'll fall in Lubbock. Why can't we do that?
Well, first of all, I thank you for your question, Olga. I'm not so sure that if we knew in March what we know today, that we would have done what we did in March. So I don't. I think going back is something that it's not. I don't think it's a feasible option where we are today. And I'll stand by the things I've continued to say. We know how to stop the spread. We just we've got to do it. There's no reason to get out if you don't need to get out. We can live life very comfortably in our own homes after we come home from work. And if I would encourage people to do that. Let's slow the spread of the virus. And let's do that using common sense.
Okay, thank you. The second follow-up question is, what is the role exactly of the health department once there is a positive and you call that individual and you say, you came out positive, this is what you need to do, and we will follow up and we'll see how you're doing. But yet that person doesn't get a call, doesn't know what to do. They're getting a little bit worse. They call their doctor. The nurse says, we'll ask the doctor, we'll get back with you. That individual still doesn't get a call. What is the role of the health department as for follow-ups to check on the individual?
Our goal is to notify all cases within 24 hours of that case being reported to the health department. Sometime, but now with these rapid tests, people know about that they're positive well before the health department gets that notification. And our contact tracers work to call those individuals the next day following their investigation, and they continue to call those people every couple of days. If the person expresses the need for medical care, we will try to facilitate getting them into the provider. If not, some of the individuals do have to go present at the emergency room. Sometimes it becomes that critical.
Gotcha.
Thank you, Olga. Now we have Matt Dotre with the Lubbock Avalanche Journal.
Morning, everyone. I don't know if this question is for Dr. Cook or the mayor, but can you talk specifically about ICU capacity? Like, I feel like, you know, every week we go over hospital capacity. I'm assuming we're just talking about the number of beds. So how, like, what's Lubbock's ICU capacity?
And I'd have to go look that up again. We haven't looked at that in several weeks. I know they have ratcheted back down to make sure that they can handle their other cases that are coming in. But I can't even venture to guess. I don't want to do that and put some false number out there, but we can follow up with that. I haven't looked at it in a while.
Okay.
I think, yeah, and I can't call the number either. I can't call the number either, Matt, but there's sort of there's two numbers. There's an ICU capacity that they run every day. And then they both Covenant and UMC have a surge plan. So if they needed to, that they could stand up more ICU beds. Suffice to say, it's many, many more than what we are experiencing today.
Okay. And the reason I asked, I was reading about Houston this morning too, and I know Dr. Cook talked about that. I mean, they were saying that they could run out of ICU capacity next week. So, and I'm assuming Lubbock is not on that trajectory. No. Okay. And then I guess, Dr. Cook, can you just kind of I want to ask you to do some speculating, like assuming nothing changes, assuming the same amount of people are wearing masks and the same amount of people are going to bars and whatnot. I mean, when do you foresee this curve? When do you see the increase in cases kind of slowing down?
Oh, Matt, I don't have any kind of crystal ball, and doctors are notorious about predictions. And so that's highly dependent on behavior of our citizens, the age and the comorbidities of the ones that are infected. And so it just all depends. Right now, it looks like it's in that 18 to 29 age group, but that's not all of them. That's about 50%. And so, and I just got a text, it looks like in one testing center, about 50% of those individuals are symptomatic and 50% are not because they were, quote, exposed. So it's just hard to say, Matt. I know that as those numbers continue to increase, we're going to get there. And so we've got to shut it down now. We've got to slow it down. And the only way to slow it down is for citizens to participate in those three things that we've continued to talk about: social distancing, wearing facial coverings, and washing your hands. That's the only way we're going to slow this virus down. Remember, we're back to flattening the curve again. We've got to flatten the curve. The curve is like this. We got to flatten the curve. That's what we talked about from the very beginning. And we did. The citizens did a good job. We all stayed in. We can't stay in forever, but we can wear a mask and we can do social distancing. Nobody wants to go back to staying at home. That is too hard on the economy. But we can take care of each other. We can care about each other and our loved ones by wearing a facial covering and social distancing.
Okay, thank you, Matt. Now we have Jonathan Seaborn with Texas Tech Public Media.
Hello, good afternoon now, everybody. So as we've seen this sharp increase in positive results, has that slowed down the rate of return of those results? And has that impacted the ability to update some of the community data? I noticed that the zip code maps haven't been updated since the end of May, and the racial demographics, there's a large section that is unknown still.
I'll go ahead and take that. As far as, I'll start with the race ethnicity. When we get an initial report, race ethnicity is not included with that information. So that requires us to go back and fill in that data entry later on. Our goal is to get case counts out to you all in the community every day at 4. So we provide what's been reported so far to the doctors. There's been a little bit of lag at one of the labs that we depend on in Austin. And that's just because of the quantity of testing throughout the state of Texas. That laboratory results can, fastest is about 24 hours. Sometimes that goes up to 72 hours. The health department has added additional contracts with additional labs, so we can really send off tests to whoever's reporting the soonest.
Thank you. And you know, not only was yesterday our sharpest increase in cases, but it was our sharpest increase in hospitalized patients as well. And I'm just curious, do we know anything? It seems like that, or it not seems like, it is that 20 to 29 group that is the biggest infected demographic right now. Are we seeing a higher percentage of hospitalizations among that group, or do we know the demographics of that increase in hospitalized patients as well?
John, I do not have the demographics on the hospitalized patients.
The other thing I might add, Jonathan, is I believe that the race and ethnicity charts were updated last night. You might double check those. Okay.
Yeah, it's updated. There's just a large, like a third of it is unknown, is what it said, and I just didn't know if there was a reason behind it. And I think,
okay, thank you. All right.
Okay, thank you, Jonathan. Next, we have the Daily Toreador, but I don't see someone from that organization. So if you are here or sign in, please raise your hand and I will get back to you. So we'll move on to Karen McKay with KCBD.
My first question is for Catherine Wells. I think about the testing. Since testing is important and more people want to get tested, even though they may not show symptoms, has the criteria loosened a little bit? So let's say if I'm asymptomatic, but I'm curious, can I go get tested and not have to worry about the cost?
As far as testing, I mean, initially during this pandemic, we really had restrictions early on about who could be tested. That testing criteria has loosened significantly. However, there's no reason to get tested unless you've had an exposure. You're more likely to, we don't see people that haven't had an exposure showing up as positive. Testing at the Patterson Library is free. The health department also has funds to reimburse individuals who have a testing bill, and they can call the health department at 806-775-2933. There's a one-page form you need to fill out for reimbursement. That reimbursement is only for the testing, though.
All right, thank you, Catherine. And Mayor Pope, let's talk about Amarillo. They've come through a lot, and now how do we compare to Amarillo in terms of severity and what they went through? And at what point would you think that we ask for help with testing here from the state? Do you think we might reach that point?
Yeah, it's a really good question, Karen. In fact, we've talked to the state. They reached out to us to ask us if we needed help, both mainly contact tracing, but also testing. We're not at that point. We are able to keep up. We've, as Catherine mentioned, we've brought in extra resources from around the city as well as from other volunteers. We've got school nurses helping us out, as an example. We are likely to work with the Texas Department of Emergency Management. That's the folks that have been doing the state response on testing, and tracing, we're likely to work with them to potentially put a testing location in one or more spots in Lubbock that have not been served well with testing. We don't want there to be we don't want there to be a barrier to people getting tested. So we continue those conversations. The state's been a good partner. You know, that when the Amarillo situation flared up, it was both the state and the feds. The CDC was an active part of that. And, you know, ours is as much as it's has its challenges, it's a very different kind of situation than what they experienced. And we'll continue with our efforts. We'll be diligent on the path we're on.
Stand by. Thank you, Mayor.
Thanks, Karen.
Okay, thank you to all our media for participating with us today. That concludes our news conference. We'll see you next week.
Thank you, everyone.